Welcome back. October is Breast Cancer Awareness Month, and in this segment, sponsored by Primary Care Plus, Dr. Stephanie Sarrat joins us to talk about early signs of the condition and why it is so important to get screened. Good morning.
Good morning. Thank you for having me.
Well, thank you for coming to talk about this very important topic. You know, I feel fortunate to have grown up in a time where October is Pink Month, October is Breast Cancer Awareness. I know it wasn't always like that, but now I feel like there really is a lot of awareness, and for good reason. What is breast cancer? What do people need to know?
Okay, so breast cancer happens when abnormal cells in the breast go out of control. When that happens, those cells can form a tumor, which can be cancerous. When that tumor spreads outside of the breast, it's called metastatic disease. That's an advanced form of the disease.
So is it possible to hopefully catch it before it spreads outside of the breast?
Yes. With regular screening, it is possible to catch it before it spreads outside of the breast.
What's an example of regular screening? I know that we're often encouraged as women to do our own self-screenings, but also to go to our doctor.
Right. So the recommended screening for breast cancer is going to be a mammogram, which is a low-dose x-ray of the breast.
Okay.
And with mammograms, which are an effective form of screening, it's possible to detect breast cancer sooner than you could feel a lump. So the American Cancer Society says that women who have regular mammograms are less likely or more likely to have their cancer detected at an early stage and less likely to need aggressive treatments.
And that's why it's so important. What is the age now that you're supposed to go get that mammogram?
Well, that depends on your risk factors.
Okay.
You know, for average risk women, it would start probably at 40, possibly at 45.
Okay, but if you have risk factors like a family member, or it runs in your family, you might need to go sooner.
You might need to go sooner, and that's an important thing to talk to your doctor about. You know, exactly when you should start and how often you should go.
You know, I feel like everyone has someone, you're only so many degrees away from someone who has been touched by breast cancer. How common is it though, statistically?
1 in 8 women. It's the second most common cancer in women, behind only skin cancer.
Wow, 1 in 8 women. Are there risk factors beyond, a family member having it? Are there certain things we can do to lessen our chances of?
There are a few things. So female sex is a huge risk factor, and females are 100 times more likely to develop breast cancer than men. So it is possible for men to get it, but much less likely. Age greater than 45 is a risk factor, and then family history and certain genetic conditions are risk factors. There are things you can do, to reduce your risk. There's no surefire way to prevent breast cancer, but regular exercise would be an effective method. The recommendation is 30 minutes 5 times a week, so at least 150 minutes of exercise a week. Limit alcohol consumption. It's possible that a healthy diet could help, but that's still being studied.
That is so, I mean, it's all these things that you hear are good for just your general health, but to know that it's actually research driven, been tied to reducing your risk for breast cancer as well. Just being healthier overall is going to reduce your risk for a lot of stuff. What are the symptoms? So, obviously if you feel a mass in your breast, that would be a symptom. Is there anything else to look for?
So a lump is definitely a symptom. Swelling in the armpit or the collarbone would also be a symptom, as would a change in color or texture of the breast, nipple discharge, breast pain. If you notice something different, about your body, the best thing to do is to go see your doctor. If it's something to worry about or not.
A lot of good information. And doctor, I think it's worth noting that you are here from Primary Care Plus. Do you want to tell us a little bit about Primary Care Plus and what y'all are doing?
Sure. Primary Care Plus is a business that provides primary care services to adults in Louisiana. At our clinics, we value quality over quantity, so your doctor will spend time with you and develop a personalized care plan for your health, and help you take meaningful steps to improve your health.
All right, so make sure you're taking care of yourself. Go see your primary care doctor. Thank you so much, doctor, for being with us.
Oh, you're welcome. Thank you for having me.